Hi everybody.
Hello.
We're back for another Wednesday Wellness, or Wellness Wednesday, whatever.
Whatever. It's
We mix them
Wednesday.
up all the time.
We're chatting. We're
Yeah,
live.
we're live
We're
here.
coming to you live. The
Yeah,
Kings of
in
Building.
this I don't- is it dark for everyone else? We feel
Mm.
we feel like there's a shadow cast
It's
upon us
fine.
today.
It's fine. We're rough today.
Maybe
I'm
it's
fine.
the gray skies.
Yeah. I'm
Um,
fine. I'm cool with it.
yeah, bracket updates.
Bracket updates everyone's
Michigan won
failing.
less.
Michigan lost last
No,
night.
that's what I that's what I meant to say. Michigan lost last night. Sucks.
That doesn't suck for me. I've
Yeah.
got Gonzaga all the way.
So.
Yeah, it benefits me. I didn't have them going in the Final Four.
Mhm.
Anyways, we're talking tongue ties, lip ties today.
Yeah. We get a lot of this all the time, but
We see them a lot. Parents see it in their kiddo a lot.
mhm.
Sometimes they're not diagnosed when they should be diagnosed. Sometimes you don't have good cuts and then they still need to be cut again. Sometimes the mom gets tongue or lip tie cut and then still has trouble nursing. And
Yeah.
so we can kind of talk how we can help with that
Yeah.
afterwards because maybe there's a reason why that's going on.
Sounds good.
So,
Cool. So we're gonna start off, tongue and lip ties.
tongue and lip tie symptoms in baby. Let's say you didn't get diagnosed with it right away. Like sometimes a midwife or provider, well, like it's a very prominent. There's different stages of tongue and lip ties. A very prominent one is like the baby's tongue isn't even gonna lift up at all. You'll see that tie right at the very front
Right
of
at the
it.
front.
But
That's
it
a
can't.
pretty easy one for parents to.
Yeah, that's the one that will usually get clipped probably in the hospital or even with a home birth. Um, but otherwise it can be more difficult. Posterior ones are hard to find.
Yep.
Lip ties can be a little harder. It's okay.
Buccal ties, yeah.
Buccal ties, yeah. So, and then maybe you're having this really hard time nursing and baby has all these symptoms and you're like, I don't know what's wrong with my kiddo. So some symptoms would be like difficulty nursing.
Yeah.
Right?
Painful latch.
Yeah. Clicking.
Yep.
Yeah. Painful latch, like clamping down.
Using their jaw.
Using their jaw or like biting. It shouldn't feel like that. Like if the tongue's being used correctly, if this is the hard palate of the baby and this is their tongue, it should be like almost like massaging your nipple like this.
It shouldn't come out flattened.
Yeah.
Yeah. Like a pancake.
Yes. So painful latch. For mom, you can have like cracked, painful nipples. You can get that blister on your nipple. You can get low milk supply. You can get more likely to have mastitis. Those sort of things. Prolonged feeding times. We see that a lot because baby gets so tired they don't know how to use their tongue properly. They're getting so tired. So prolonged feeding time. So baby, you see, like we said, clicking during eating. Latch is like probably shallow. It's the clamping. Reflux can actually be caused from it because probably getting more air in.
Oh yeah, yeah.
Gas. Drooling a lot.
And also like baby not getting enough milk too.
Yeah, and no weight gain.
No weight gain.
Yeah. Failure to thrive.
We've had 2 kiddos this week that have been that are doing awesome. Not that they're getting adjusted, but mom's gone through like the rigmarole, just like trying every single thing, like had all the ties clipped and stuff like that. But we'll talk more about that later.
Okay. So ties. We get diagnosed. Usually, a lactation consultant, I think, is probably a great place to start.
Yeah.
I think they're pretty good at diagnosing like what's going on with your nursing and what if there is like a tongue or lip tie.
Yeah.
I would say.
They're awesome.
Yeah.
We refer a lot of people to Chiro.
Yeah, Chiro is amazing.
Yeah. She sends a lot of people to us.
She knows
She's
so much.
Awesome. Yeah.
About it. And then from there, we have some great providers in our area that do the laser cuts because not all. Hi, Mom. Not all tongue ties and lip ties, like procedures are created equal because there's scissors, there's lasers. The lasers usually heal a little better. Don't grow back as much because they can grow back. It's tissue. That tissue can grow back.
The laser is a little like it's faster. It's a little less invasive, and it like cauterizes the tissue immediately too. So, but I mean, there's a lot of good pediatric dentists in the area. So, if anybody's looking for one, just reach out to us. We have a couple.
Too, okay. So let's say your baby has a tongue, lip tie, something's going on. What is it even? So it's like a midline disorder.
Yep, centralization, right? Yeah. So, it's often a deficiency. So this is really important for any mom who's like preconception, prenatal, or even like early pregnancy. You want to make sure that your prenatal has active folate in it. That is like the big one. That's why most moms need to take a prenatal vitamin. There's a lot of good nutrients in there, but Folate is one of the biggest ones that we don't get it in our diet normally in high enough levels.
Yeah, and it's a midline disorder. That's why you also need it for like spina bifida.
Yep, exactly.
Spina bifida happens.
Even like what am I, the palate too, like palate non-closures, stuff like that.
Cleft palate.
Cleft palate, thank you. Gosh, I can't think today. But so folate, super important. One of the reasons that we don't get enough, it's not just that, but we also, most of our food that's processed is enriched with folic acid, and that competes with folate in our diet. So when moms are pregnant, if they're eating a lot of like processed foods and grains and stuff like that, then they're getting a lot of folic acid. So then that folate that they're taking may not be enough. So really, like when you're pregnant or preconception, try to eliminate a lot of that like enriched foods, because your prenatal can do better work then. And so that's better, just like preventative, a lot of those midline disorders.
Other ones are your B vitamins. So B12, B6, B2. So that's riboflavin. Is what it might be seen as B2.
Yeah.
So the other ones, I think you'll see the actual number there. So those are really important ones to be taking pre-conception, even not even like when you're thinking you want to get pregnant, start taking those now. It takes like 6 months to build up in your system.
Yeah, and especially if you are like vegetarian or vegan, make sure that you're taking B12 and B6 and all those too.
Okay. Yep. So that's what mama can do to help. Okay, so now your baby, let's say you've had all these horrible nursing issues, baby is not a happy baby, not gaining weight, you go get the tongue tie clipped, and then baby's still having issues because they have to relearn how to suck. Yeah. Because what happens is the baby starts the sucking reflex the third trimester of pregnancy.
So while they're still like in utero, they're learning a lot of like how to move their tongue, how like what their sucking reflexes and stuff.
So I'm gonna kind of show you an example. So like let's say you have a tongue tie and baby's tongue, since it's tied down, baby's tongue can only move this much. So they're learning to only suck like this. They've known that since in utero, then they are delivered and they're still sucking like that. Now it's cut and it should be moving like this. But as we always talk about, your body has a muscle memory. Yeah. So baby is not going to really know how to use those muscles yet to be doing that. Yeah. So how we help. Yeah. Yep. We can kind of talk about that. Annie sees a lot of the tongue tie babies.
Yeah. So I see a lot, like, I mean, any latching difficulty, anything like that. We do a lot of checking. So after ties get clipped, there's a lot of exercises that mom and
whoever clipped it should be giving you exercises that to like help with the sucking, helping how to use the tongue. We have a whole PDF file now that we can give you, but there's a lot of different exercises. It's going to be kind of uncomfortable for baby. Like they're sore. Touch the back of your tongue. It's not like comfortable. And then they just had it like cut.
Had it clipped. Yeah, exactly. So those exercises are super helpful. But as we know, because you've watched all of our videos and you know how the nervous system works.
All of them.
We also need good nervous system communication in order for those muscles to fire properly and to even be able to learn and to solidify and make that plastic, basically, to make it stick in their neurology, how to use their tongue again. Yes. So like your light switch.
Oh, analogy, yes. Yeah. Okay, so we need that good, like you said, muscle memory, neuromuscular integration to really remember, like, okay, this is how we use it. So we, like, as chiropractic, we can provide that by like changing the neurology, by adjusting the spine. But yes, a good analogy is, let's say you have a room, we have a room, we walk in the office here, we know right where the light switch is, we can touch that light switch, we don't think about it, we like know right where it is. Muscle memory. Let's say we remodeled this room. I don't know why we got to remodel it, but we did. And the light switch is across the room now. So like, how often do you think you're still gonna walk in and touch that light switch that's like in that old spot? It's gonna take, I don't know, probably a few weeks at least, if not longer. But you remember, oh yeah, it's across the room. So then you can go across the room, and then you're like, oh, there it is. But you can't. It's gonna take you a while to find on your hand like, oh, where it is. You can't just like touch it. You're still looking for it.
I still like go in my bathroom and go like this, and I'm like, the light switch has never been there. I don't know why.
It's just like, yeah, so that's kind of a good analogy of like how muscle memory works, and so why these kiddos need chiropractic care, need craniosacral care to really integrate that new neurology.
Yeah,
and that
exactly.
New muscle memory.
Help wake up those nerves that are supposed to be controlling those muscles in their mouth, swallowing, tongue,
which are coming through the cranial bones.
Yep.
So cranial work's important. The tongue is like attached to your jaw and stuff, so it's important for us to adjust those areas, check what's going on there. The rest of it is attached. The dura attaches throughout the whole spine. That's why we check the whole spine. That's why
exactly. Because it's all attached. Yeah,
it's all attached.
It's all connected. Yeah, and if baby has those ties, that is like, usually babies are pretty tense and stuff too. A lot of those like I mean, it's the same kind of mechanisms. Like if they have ties there, then their dura is probably really tight and tense too.
Yeah, you'll
So,
see it on top and bottom.
Yep, exactly. So,
they usually have other issues, probably pooping issues or something.
Yeah.
So, you've seen huge changes this week with
yeah,
babies.
so we had 2 babies this past week, or that came in last week. Both of them were like not gaining weight, really close to like failure to thrive. Like their peds were throwing out that term and,
Yeah.
Really freaked both moms out. So babies weren't gaining weight. They had both had like a bunch of ties clipped. I think like lip, tongue, posterior tongue, buccal, like just all like going through the gambit again. Had both seen lactation consultants. Um, One of them was like going to OT for tummy time because baby, like again, that dur is really tense, so she didn't like lifting up her head and being on her belly and stuff like that. And they were just like going craniosacral therapy, and like all of this stuff adds up. Like it's all very expensive, and it's time consuming because mom's going everywhere.
It's hard for mom to get out of the house.
Yeah, and it's stressful. And so like this has been going on for like six-ish weeks, and like it's exhausting. And so mom came in here and we talked about it. We did the scans, saw that she had an atlas subluxation, and like a pretty severe one. Like there was like 10-degree difference on the thermal scan or something. And so we adjusted her and she went home, and mom was like, she nursed like a champ. And I did not expect that at all. Like it was just kind of completely, she was like, I don't know what kind of magic you did, but like,
the missing link to the
yes,
puzzle.
yes. She was like, it was like euphoric to have this kind of like this
she probably
change.
felt like that like lapping motion instead of like and all of a sudden it probably connected in baby's brain like, oh, like you got the nervous system like fired up, like this is how we're supposed to do it.
Yes, yep, exactly. So all those muscles were working and coordinating together the way that they're supposed to. So that was awesome. Both babies have had like great results. They've both been gaining weight now. And they're like raising in their percentiles and stuff like that. Nursing's been awesome. They're both moms are like, they're so chill after they get adjusted. Like my tense baby is all of a sudden like after they get adjusted, then they hold their baby in their arms again. The baby's just like,
they were so tense because of that like all that dural stuff. Yep. So some moms are like hesitant about getting the tongue and lip tie clip, and it can create issues later on, whether it be with speech or eating. Actually, like cavity, because you're not using your tongue properly, that can be like cavity issues. It can grow into adulthood with TMJ issues and headaches or whatever it may be. Like tongue and lip ties have a lot of issues. So if like someone sees one and they're recommending it, it's like, do you want to have to cut it later on when you're gonna remember maybe when they're like a little baby and not remember that pain so much? And then like I said, we have ways to like help them better integrate with that.
Yeah, exactly. We had another kiddo who was, I think, 3 or 4, but she hadn't had her tongue tie clipped until later. And mom noticed a lot of like speech issues and stuff like that. So she was going to, I don't think they had started speech language pathology actually. They hadn't started anything yet, but she just wanted to like get her checked and get her adjusted. And after like a couple of weeks, mom could understand what she was saying so much better.
Yeah. I understood her. I was like, that's amazing that you can understand her
because before that, like mom couldn't even, and moms can always understand what their kids are saying. So
for sure.
Yeah. Yeah.
I don't remember now. Shoot. Getting baby adjusted.
Yeah.
Oh well, I'll put it in the comments if I remember. So.
Yep.
Yeah, tongue ties. It's a thing. It's a lot of kiddos have it.
Nursing
doesn't have to be so horrible. Nursing's difficult. Like it can be difficult, but if you really want to do it, something really important to you, like, and you can tell something's wrong and not normal, like get to that lactation consultant and have them check it out.
Yeah.
And then like I said, we have some really good providers here, some dentists that do those clips.
Yeah. And if that's something that you want to do, like even if you're not into nursing and stuff like that, like it's important for baby because babies, like that's a natural thing that babies should be able to do.
Oh, I know. One of the signs was
remember.
Yes, I remember one of the signs. It was also just one of the signs like how maybe they have a tie that you can't see, or that their tongue will curl up like in a circle because it can't lift up all the way, and they'll have that red tongue in the front, and the back will be white, and it gets misdiagnosed as thrush all the time.
Oh, that's
interesting.
But
it's not thrush, so they say they're on thrush, and they have to go on all these antibiotics and stuff, and because they're like, oh well, mom's in pain, so it must be thrush. Baby has a white tongue, but it's because their tongue isn't working properly.
So it's still like milk. Yeah.
Yeah.
that's super important because babies on antibiotics I mean, that wipes out their
issues.
gut. Yeah,
immune
exactly.
System.
Immune system.
Issues later on.
Yeah.
So
we'll
those
talk
are some
about
things
that.
to look for. Also, like lip ties can be harder to find. One of the things was a big that I just learned was like how they're sucking, they'll get like a red line crease right here.
Interesting.
Yeah.
Yeah, because of
they're not sucking properly. So that's something that maybe they don't have.
So if your baby has a little red mustache.
Yeah, a little red mustache.
Like Benny.
Benny has one?
He has an orange mustache, but.
Oh, right. Oh, yeah.
Mm-hmm.
Lip blister, yeah, the two-tone tongue. I have palate, which you guys aren't probably going to know that,
but we will.
Oh, and the tongue doesn't lift when they cry. When they cry, their tongue should touch their palate because it's a soothing mechanism, I guess. And so when it doesn't, like if it's staying down because it's tethered down, like that's another sign of a tongue tie.
That's interesting.
When they're crying.
Yeah. Makes sense.
All right, there you go.
All the tips.
Whirlwind. In the end, get them under chiropractic care.
Yeah, exactly. Get them adjusted.
Get them adjusted.
Check out that
lactation
consultant.
Your mama then. So.
Yeah, it makes life so much easier. Yeah, and it makes all those other therapies. So even if you're like, I still want to do the OT, PT, like all that stuff, chiropractic care just helps all those things work better and all those things stick better. Again, because it's neurology and it makes it's that like neurofeedback.
Yeah.
So yeah.
Neurofeedback, brain's communicating with body.
Yep, exactly.
All right, awesome. Have a great week. I'll be gone next week, so
it's all me all week.
I don't know if Dr. Anna will jump on next week. Probably not.
We'll see. We'll see how I feel on a Wednesday.
Maybe I'll get in from Florida.
We'll beam you in.
Zoom.
That would be fun. All right. Well,
all right. Talk to y'all later.
Have a good week.
Yep. Bye.
Bye.